Thank you so much, Ismail. Just a reminder again to please turn off your camera so that we can spotlight properly our ASL interpreters. Again, please turn off your cameras so that we can spotlight our ASL interpreters. And I think with that, we can start our meeting. We have here today Matias Valenzuela. He's the director for the Office of Equity and Community Partnership. He is here today for the first half hour to cover some COVID things while Becky's out in a conference. Becky will join us at 4 p.m. to continue the meeting. So thank you everybody for being here today, and I'll pass it on to Matias. Welcome, Matias.
All right, thanks, Gina. Thanks to all the interpreters who are supporting this call. And also thanks for Becky, my co-presenter today. So we have split this up today, and I'm going to be taking the first portion, which is more COVID focused and covering the issues there. What I want to start with is and this is a new dashboard that we have actually in the last week. We have updated, and if you go on our COVID pages, you can find some new information and ways that we are presenting things that are hopefully easier to read. They're also these are all very friendly on smartphones and different platforms as well. So hopefully you're going to find this even more usable. But this is what we're seeing here. This is the categories and how we assess community level of COVID per the CDC categories that we decide whether a community is in low, medium, or high COVID activity. So with this, what we're seeing here is that Omicron in the top one, which is around the cases, you can see that the BA2 and the BA5 wave of Omicron did plateau in late May. It had been sustaining through much of the summer and now has been decreasing gradually since mid-July. So over the last month, really, we've seen a decrease in COVID across all groups. So we are currently overall, as you can see here, at the low COVID community level. When we think about these reports and we see those numbers, it's also important to remember that cases really reflect PCR results and does not include a lot of the at-home tests. So there is really an undercount in the number of cases. So when you see a lot of the reporting that happens, whether through King County or the state or federally too, it's only generally reflecting the PCR test. So those are what people that go to testing sites, for example, and not the rapid or at-home testing. Even though we are trending down, and you see that very significant downtrend now that we're seeing, there's still likely a few thousand new cases in King County every single day. At the same time, too, around that, hospitalization rates have decreased. That's that 3.1 you can see there, by almost 50% from the most recent peak there in mid-July. Just so you get a sense of what these numbers mean and what they translate into. In a recent just 7-day period, we had 10 people who were hospitalized each day, or one person every 2.5 hours. So this is similar to what we would see, like what we are seeing now around COVID hospitalizations. It's similar to what we would see during the peak period of a moderate severity influenza season. So it's pretty significant. Influenza is also, kills tens of thousands of people every year. And despite the decrease in hospitalizations and cases, for most of the summer, deaths have remained relatively stable. So this is around, we see about 2 to 4 deaths per day. Over the past 14 days, we can say deaths have trended down to an average of 2 deaths for COVID per day. Just to put also this into perspective, if recent levels are sustained, that is 2 per day, COVID would be the 5th leading cause annually of death in King County, and more than many things such as unintentional injuries, stroke, diabetes, influenza, and pneumonia. In terms of who is in these categories of also being hospitalized, they tend to be, in very large part, more than 80% are people over 50 years of age. And in terms of the deaths, it actually happens to be 91% are those 60 and over. But sometimes people think that young people are not impacted. We do see about 5% of the deaths and hospitalizations are among those under, but specifically around deaths are under 20 years of age. So you can see that across all age groups, people are impacted, even though among the older populations, there is more impact. So kind of in summary for this one, it is COVID activity is decreasing. You can see there, although we continue to see a significant number of cases, hospitalizations, and deaths. Also, the problem of long COVID, it's not really reflected here, but we can see that it's still very significant, and it's often kind of underappreciated in public health. We're seeing it increasingly as a public health issue and a huge burden for community and the workforce. We estimate, and that there are really different estimates on this because it's still being defined per se exactly what would constitute a long COVID case, but about anywhere from 5 to 40% of people with COVID-19 also suffer from long COVID. So again, to put this one into perspective, that means that there are tens of thousands to hundreds of thousands of long COVID cases in King County alone. So I think many of us hear of people in our families or even ourselves or in our workplaces of people are really suffering from the long-term debilitating effects of long COVID. The pandemic is, of course, continuing. We are still in the pandemic. It may continue to evolve. We might have fewer kind of the larger surges, but still we are having substantial hospitalizations and deaths. And really the large part of the burden is among unvaccinated individuals, older adults, and those with underlying health conditions. Really, as you know, even though many folks don't want to hear it, it is clear that COVID-19 is not disappearing, it's changing. It's less severe in important ways, but it's still very persistent, having a huge impact, and it actually remains somewhat unpredictable. With high uptake of vaccination and also updated boosters, and we're going to get a little bit more into that soon, plus immunity from prior infections, you know, in the absence of any new major new variant that evades past immunity from vaccines and past infections, the severity and impact of future surges should be limited. So that's a bit of good news, but it's still significant. And we are continuing to prepare for the fall and the winter. During these periods, there is always tends to be higher activity as people go indoors and cold temperatures come. So we are still pushing what we called, you know, the layered approaches, and multiple prevention strategies, including ventilation and mask wearing, is extremely important, even though many of these things now are recommended and not being required. So with that, I'm going to move into the next slide. And this is just to reiterate, I want to reiterate and show why the single most important step for us within public health continues to be to protect ourselves through vaccination. And you can see here, but this is a figure for the Omicron surge. So really since December of last year, you can see that those who are not fully vaccinated are about 2 times more likely to test positive for COVID-19 than those who've been boosted. And then around hospitalizations, people who are not fully vaccinated are 12 times more likely to be hospitalized for COVID-19 than boosted individuals. And then for deaths, you're 19 times more likely. So those who are not fully vaccinated are 19 times more likely to die of COVID-19 and related illnesses than those who are boosted. So that is kind of an important factor. I do want to cover a little bit here also around that, you know, and also applaud our community, because we have made some amazing and really wonderful progress around vaccination. And this figure here shows, and you can see if we look at that first orange area around that primary series, it can be 1 dose of Johnson & Johnson or 2 doses of Pfizer and Moderna. You can see about over 2 million people in our county. So we have a county of 2.2 million people. So over 2 million people, or over about 91% have actually started that primary series. And 82% and almost 1.9 people have completed. But where we begin to see really the challenges are, only about half the population has received 1 booster, and only 12.5% have received 2 boosters. Not everybody had the recommendation. It was only for those 50 and over and those with underlying health conditions who would be recommended to receive that second booster, but the numbers are quite low. So really, overall, we only have about 42.5% of the population with up-to-date vaccination. And this is not including right now the new updated vaccine. If we go here to my next slide, I just wanted to show, this is showing more around that last 42.5% of those who are up to date to vaccination, to just continue to also talk about who is really impacted. And we are still seeing, and we are seeing, especially in the Black and Latinx community, lower vaccination rates. We were doing among our communities of color and BIPOC communities, we were doing quite well in the primary series and often achieving over 80%. But when we are getting into the boosters and getting into updated status in terms of vaccination, you can see that especially when in the Black and Latinx community, it's significantly lower. And then in the Hawaiian Pacific Islander community, it is also lower than the county average. So those are areas where we continue to focus on in particular. But then also you can see that across all racial groups that we continue to see that we have progress to make, and we have to do a lot more. I think also this is going to be, this information is really important to understand, because this is also driving and influencing our strategy, and we're going to be focusing on as we move into the updated booster vaccine, which is what I want to talk about next. And this is something that has been a lot in the news, and want to share information around this. So why do we need an updated booster vaccine? Really still for, and as I've been saying, in terms of the steps we can take in our layered approach, vaccines are really the foundational strategy in public health for individual and community protection. The booster vaccines have been updated just because the original vaccine that was authorized already a couple of years now, 2020, we have seen that COVID-19 has evolved, and there are new variants, Omicron being the latest. And the new variants can actually dodge some of the immunity we get from infections as well as from vaccination. So that's why it's really important to actually have these new updated booster vaccines for COVID. And this is something that we've been expecting, and now is a perfect time as we head into the fall to do this. They are really intended to improve protection against serious infection against COVID that are circulating today. So they target both the original strain that we've had and that the regional formulation had, plus the most common current variants, which are the Omicron and the BA4 and 5. So that's why, since it has those double areas of focus and targets, it's also sometimes called the bivalent vaccine, or we call it, just in simpler terms, the updated booster vaccine. So having the updated booster vaccine authorized and now available for us, this happened a couple of weeks ago, really gives us a new opportunity to prevent many new infections and hospitalizations and deaths as it continues to spread. COVID does continue to spread locally, and provides a really higher level of protection. So it's a great asset to have now as we enter the fall and winter, when we, as I said, transmission will likely increase. Also, this updated booster are now recommended to improve the duration and the strength of protection against today's variants. And there's also reason to believe that they will provide broader protection against future strains that may evolve. As we know, we've had, we had Delta and we've had others as well. So actually having ones that now are protecting against the current ones will also best protect us against potential new ones that might come next. And the virus will continue to evolve. As I have here on this slide, you can see the new booster recommendation have been simplified. It's basically everyone 12 years and older is eligible for an updated booster if at least 2 months have passed since completing their primary series or receiving the last booster dose. Getting all the recommended booster doses is especially important for people who are at increased risk of severe COVID-19 hospitalization and deaths. This includes people who are 50 years and older, those with a weakened immune system, who are pregnant, or people who are pregnant, those with one or more common underlying health conditions. And what are those? Those can include things like diabetes, heart or lung disease, kidney disease, overweight and obesity, cancer. There's also certain disabilities and more. So especially as again, to reiterate, this is available for everybody over 12, Pfizer for everybody over 12, Moderna for anybody over 18, but especially we want to focus on those populations that are also at higher risk. Also, and I've mentioned long COVID, and vaccination too can lower the risk for long COVID, which can also lead to serious health problems that can prevent us from, going to school or working or do other activities that are important. The last section there talks about availability, and I just want to touch on that, accessing the booster locally. It's just important to know that sites may vary in terms of availability of the updated boosters, but we're having significant numbers arriving now each week. Local healthcare systems and pharmacies have started to receive it. We have our Auburn Outlet Collection Mall vaccination site and our Eastgate Public Health Center. Those are also very good options. And there are other providers. This includes Kaiser Permanente, UW Medicine, HealthPoint, CMAR, Snoqualmie Valley Hospital, International Community Health Services. They have all been receiving updated booster vaccine supplies. So those are all excellent places to go. We also continue to have our mobile vaccination teams, and there are different mobile teams going to different places. We're going to senior centers and senior housing. We're also doing events both at senior centers and for places where older populations may be, and also working with Seattle Housing Authority and King County Housing Authority to really get shots in people's arms. And we are going to continue to, provide, more options as well. And we do have our kingcounty.gov/vaccine webpage, which is an excellent, place to access the vaccination information. I will just end by saying, actually today I did see some initial statistics that showed where some of this updated booster is going, and I will just say it is. I'm reiterating our focus to keep this equity focus front and center. We are seeing lower vaccination rates in South King County. We are also, seeing around some race and ethnic groups lower rates. I mean, it's all very new and the numbers are relatively small because we've just started to vaccinate, but we are seeing just the same that we had seen before. Among the Black African-American population, among the Native Hawaiian Pacific Islander population, and the Hispanic Latinx population, we are seeing lower rates. And the place that we are actually seeing a lot of people accessing the vaccine are our pharmacies. So there's a federal program that is geared and working with pharmacies. So those are actually a really important place of accessing the vaccines. So with that, I will pause, or I'll stop. I'll stop my sharing. I know Becky, when she comes on board, she will have some slides herself, and then if there are any questions, I'd be happy to answer.
There's a couple questions in the chat. Do you want me to read them to you?
Sure.
The first one is, how widely available is the new vaccine booster?
So the availability, it's quite, it's quite available, as I was saying. It's you can go to pharmacies, you can go to our Auburn site. You can actually, for our Auburn site, for example, you can make an appointment, or you can show up in person. So so there are many different places. Those places that was, and you can still call our number too, which is our COVID hotline, to get information about that. But it's increasingly available.
Okay, and the second question is, how long do you have to wait after having COVID to get the new booster, which is 2 months? Oh, sorry, after having COVID. Okay, I'm just gonna let you answer. How long do you have to wait?
Go ahead, you already answered it, Becky. Go ahead.
Well, I was answering for the vaccine for your last booster. So the question is, how long do you have to wait after having COVID to get the new booster?
So that's for the recommendation, there's 2 months.
2 months still, okay. And then is it 3 months after your positive test, or 10 days after that, or does it need to be that specific?
That is a good question. I'm not sure. Yeah, I think that, I mean, what I've heard is 2 months. So
yeah, I would guess 2 months. I mean, I would take it at, I don't usually guess, but I would say, 2 months and 10 days, because you are after 10 days, we're going to assume if you don't have a fever without medication, and you're not having any new symptoms, the assumption is that that is when your COVID is over. We don't recommend people taking tests after having a positive test, because sometimes people continue to test positive. So 10 days after you test positive would be when you would assume that your COVID is over, and then it's 2 months after that. How is that for some long answer?
So in short, I think it's 2 months. So yeah, after, which you would consider after your day 10, after testing positive. So that would be after that day 10, wait 2 months.
Yeah. And I think, yeah, sorry, Carrie. I got real technical there. All right, awesome. Any other questions for Matthias? They have to, oh, it's 3:59, they gotta go. So I'm happy to share my screen and take over and answer any questions. And I do have your slides as well, Matthias. And in case any questions come up, I can refer back to those as well.
Great, thanks everybody. Take care.
All right, thank you, Matthias. I appreciate you filling in for me while I was at the conference. And then,
Bye-bye.
yeah, bye. All right, hi everybody. I don't, Gina, do you happen to know if a lot of folks came in after the initial announcements for how to find the interpreters?
We had 40 folks when we made the
Okay.
announcement. We can make another announcement if you want to.
No, I think it's okay. It's just 10 more. I think it's okay. So hi everybody. You all know my spiel for folks who are regulars. But my name is Becky Reitzes. I work for, obviously, Public Health Seattle King County. I've been here 21 years as of last month. You told me at 27 I would do anything for that long. I would have left, but here I am. I've been working on COVID since March of 2020. And one of the, again, you've heard the spiel, but one of the reasons I think it's really important to say that is there's been a lot of changes. Obviously, we know that since the beginning and since last week. So I always want to give people an opportunity to, you know, ask questions. I think those changes can sometimes lead to distrust of our messaging and lead to folks feeling like we are not trustworthy. So always feel free to ask. And then if you don't want to ask out loud because we are recording, you're welcome to either, Gina, do you need to go? I wanted to check in with you because I know that you are super busy. Do you need to jump out of the meeting or are you here for the meeting?
No, I'm here for the meeting. I'm also
Okay.
recording. So if I leave, yes,
Okay.
we wouldn't have the recording.
Okay, awesome, thank you. So you are welcome to either direct message Gina, or you are welcome to direct message, I would say Gina in case I miss a message, if you want it to be private. So I'm gonna go back actually to what we're gonna cover during my section. I just added, this is wrong. Take that out. I just added a new study came out around pregnancy and the COVID boosters. So I wanted to make sure to add that in. So that's where we're going to start. And then there's a new child care subsidy program. Usually I put those under resources, but that's a big deal. Like folks really need support. So we're going to talk about the subsidy support. And then I know last week we had 3 guest speakers around the childhood, around the school, the school guidelines and recommendations. And then we'll do a monkeypox update. We're not going to go into all the details again on monkeypox. Again, unless folks want to, I have no problem with like reviewing information if people are interested, but just give some new information or new numbers and things like that. All right, and as always, feel free to interrupt me. I am Jewish. I like to say we talk alongside each other, but we do talk alongside each other, which looks like interrupting a lot of the time. So please feel free to interrupt, ask questions, put them in the chat or direct message to Gina, and Gina can interrupt me. All right, so there is a new study. I'm going to slow down. Sorry. Sorry, interpreters. I'm going to slow down. Sorry, I just presented at a conference and then wanted to make sure this section got into the presentation because I think it's important. So I'm rushing. So the University of Washington did a new study to look at the safety of boosters during pregnancy and during breast and chest feeding. And for folks who don't know the term chest feeding, it is being inclusive of folks who are trans, transgender, gender non-binary, gender fluid, agender, and many other gender identities. And this study was just released on the 8th, and I will make sure to put the, I did not actually put the, I always put links where you can find things, but I neglected to do that. So I'll do that before we send it out. Oh, and I also want to apologize for getting the info out late. you'll notice that Justin is not here today, and I got it out late, so I apologize for that. All right, so the big importance of this study is that, as we all know, COVID-19 vaccine won first of all, the primary series. So in order to get your booster, obviously you need to get your primary series. We recommend doing the mRNA vaccines. So, and specifically, I'm going to say Pfizer and Moderna, because Novavax has not been, there is no booster yet allowed for Novavax. So COVID-19 vaccines and boosters, or third doses, again, for folks who are immune compromised, they also need a third dose, which is not a booster. It's 4 weeks after their second dose of their primary vaccine. I'm sorry, their primary, their primary vaccination series. 4 weeks later, they would need a third shot in order to be as highly vaccinated as someone whose immune system is not compromised. So, as we all know, vaccines, boosters, third doses are recommended for adolescents and adults, and boosters and third doses are recommended for folks who've completed their initial series. So unfortunately, we've had minimal data. We have had data. I want to be really clear. We have had data on safety of the primary series of vaccinations. Oh, I just realized I left a really big word in there. I don't like to do that. But we had, so in the original studies, they did not include folks who were pregnant or breast or chest feeding, but they have, since the vaccines came out, they have included people who are pregnant in the studies. Also, millions and millions of folks who are pregnant and breastfeeding or chest feeding around the world have received the vaccine and are doing just fine. They do not cause miscarriages. There's so much misinformation and disinformation online, which is that purposely spreading misinformation about how dangerous it is. So this study was really important because it was a very large study, and it specifically looked at the boosters. And they wanted to see in the study the reactions to the boosters and the safety and effectiveness of the boosters among people who were pregnant and breastfeeding or chest feeding. So, ta-da! The research showed that COVID-19 booster shots are very safe and effective. Oh, go ahead.
Becky, sorry. We can't see your slides if you're supposed to be sharing them.
Oh my God, thank you so much. I am, and they're really cute. Hold on a second. I mean, am I the only person in the world who thinks slides are cute? I'm so sorry. Thank you for telling me. You're always welcome to interrupt me and tell me that stuff. Like, God, you think I know this by now. All right, well, that was my first lovely picture. And my second lovely picture. All right, so the research did show us that COVID-19 booster shots are safe and effective. This is during pregnancy, but both during pregnancy and also during when somebody is breastfeeding or chest feeding. So people who were pregnant, and I'm going to use the term lactating because it's easier for me than saying breastfeeding and chest feeding every time. So when someone is lactating, it means that they are breastfeeding or chest feeding their baby after birth. So boosters and third doses were well tolerated. They had very similar side effects, and this is super important information, because we know that folks who are pregnant or who are breastfeeding, chest feeding, are not getting vaccinated at the same rate as people who are not. And so it's really important for us to know this information, and that, where does the number go? Well, I guess the number dropped off, but there were over 17,000 people in the study, which is, again, a very large study. So in that study, they didn't have to halt it for any reasons, any negative reasons. There were no problems. Again, there's no increased risk of miscarriage with folks who are receiving vaccinations when they're pregnant, and they're very safe for breastfeeding, chest feeding. So it's super important for us to get that information out, because the opposite is true of someone who is breastfeeding or chest feeding or is pregnant, gets COVID. So if somebody is pregnant and they get COVID, their immune system is compromised because of having COVID. And they are folks who are pregnant who get COVID, and I'm not into fear factors at all or scare tactics. This is just the reality is that people who get COVID during pregnancy are much more likely to end up to die, end up hospitalized, end up on ventilators, and have health concerns for I believe it was a month and a half after after having COVID, or I'm sorry, after the pregnancy. So it's not only during the pregnancy that the issues occur, but even post after giving birth. So I know we've covered that before in previous presentations. I just wanted to mention it. So this study is great, because the big take-home message is that the COVID boosters and the primary vaccines are safe and effective during pregnancy. And not only are they safe and effective, but what we've known already with the primary vaccines is true for the boosters, which is that people actually are not only protecting themselves when they get boosted, but they're protecting their pregnancy and they're protecting their baby after birth. And during the pregnancy, they're passing antibodies and other protections through the umbilical cords. And that is going to mean that the baby is going to be born with protection because they got it during the pregnancy. And then if folks are choosing to breast or chest feed, which is super healthy for both the person giving birth and the child, they're also sharing their COVID protection through the milk. So we knew this was primary vaccines. We had no reason to think that this wasn't true, but it's wonderful that somebody actually did research. I'm assuming the research was primarily on women, and women often get left out of research, but want to make sure to say that anybody who is pregnant, it is safe and effective, and they are protecting their pregnancy and their child after the birth. Are there questions at all about, and again, there were over 17,000 people in the study. Any questions at all about that research? And again, I'll put the link to the research in when we send this out. So if you are somebody, sorry, I interrupted myself. I did a series recently with specifically with folks who work with people who are pregnant, and then also people who are pregnant and or have children up to 5 years of age. It's super important for us to be having conversations that are respectful with folks who are pregnant, and dispelling the really awful myths that are out there. So I'm going to put my email in the chat if you are somebody who works for an agency and work with a lot of folks who are pregnant or breast or chest feeding, and would like either a conversation, like a presentation for those folks in multiple languages. It could be we have presenters who can present in multiple languages, or if you would want a training for your staff to be able to share this information in more details and in respectful ways. I think it's super important for folks to know, especially given the high rate of death and hospitalization of pregnant folks if they get COVID. So questions at all around this research that just came out? Also, y'all know that I'm a sexual health educator when I'm not on COVID. So to me, this is super exciting stuff. And to other people, they're like, oh, man. All right, we will move on. But again, if you have questions, come back to it. So we have a program, it's called Best Starts for Kids. It is a voter approved initiative. Voters have approved it twice now, and it's a 5-year initiative. And the idea for Best Starts for Kids is to invest in our children and invest in our youth. One, I want to thank everybody who's voted for it because it is an amazing program. What people often don't realize is the more you spend on prevention, the less you have to spend later on fixing issues or problems or on treatment. So investing in prevention, which this is really the ideal. So Best Starts for Kids just released, and I specifically wanted to put this whole page up here so you can see that the application is in many languages. For folks who, again, who work with with folks who have young children, or who, work for social service agencies, we really want you all to help us get the word out. We have a whole toolkit, and a lot of these lovely pictures that you're going to see come from the toolkit. I have them in English here, but we have them in many languages: Amharic, Arabic, Chinese, Oromo, Russian, Somali, Spanish, Vietnamese, and there may be more to come. And so I'm gonna, and all folks have to do to find out if they're eligible is to fill out a very short form, which should only take about 5 minutes. So the subsidy is really to help people pay for childcare. And I already mentioned they just need to fill out the 5-minute form to see if they qualify, and it is in multiple languages. In order to be eligible for the subsidy, they have to live in King County. They have to have 1 or more children below the age of 12. Oh, just a reminder, you all know that I read slides when I want to make sure that the interpreters are, the interpreters that only interpret what I say and not what's on the slide. So I am going to be reading some of the slides. So folks are eligible for the subsidy, and subsidy meaning some support in financial support, some money to help pay for childcare. If they live in King County, they have one or more children under the age of 12. They're using a licensed childcare provider, so the childcare provider has to be a licensed provider. It can't be like a family member who's not licensed. And they're not eligible to receive Washington State's Working Connections Child Care Subsidy, so which is a different subsidy that will also help support folks in paying for childcare. And I'm not going to read all these, but they do have to have specific income limits. So we're going to send this out, and you can see what the income limit is. Or again, if you need it in another language, you can go to the site, which is, again, these are live links, and click on the language you need, and then you will see this eligibility income limit in the language that you need it to be in. So just hold on one second. I apologize. Let me pull. There we go. Because this is a new program, we're not sure how many families will apply. We know a lot of families need this and more. So we just want to make sure to let folks know that by submitting the form, it's not a guarantee that your family will get the funding. And I think that can often be confusing. So it's really important to know that. And there may be families that are interested, but that we're not able to serve due to not having enough funding, depending on how many people do apply. And then the program will contact families if they're selected to complete the full application by the end of September, so in the next 2 weeks. So really, folks want to do the application as soon as possible. And I'm looking to see who's on here, but again, for folks who work for social services, if you can help families and get the word out about this, it would be super helpful, because we all know how, I'll say social services, and also for like faith-based organizations and mosques and synagogues and churches. So to get the word out so folks can get the support that they need. This is just one example of a flyer that you can print out. And again, this one is in English, but we do have them. Again, we have a full toolkit in all of these different languages, and there's folders. So I know they're kind of small, but you can see each folder has the full toolkit in it in the correct or in the specific language mentioned. I was really excited about this, and I hope other folks will be just as excited and help support and get the word out about this new program. Any questions at all from folks about any of this? All right, so if you are a parent or guardian on the line who needs this, go fill this out. If you're somebody who works with folks who have young children, please, please, please spread the word. Hi, Lena. Sorry, I was looking at the chat. All right, so we did the updated school guidance and recommendations last week, and we had 3 lovely guests. And then since then, Public Health has released a toolkit. Sometimes I get tired of the word toolkit. I actually created a toolkit. I called it a support kit. I'm like, maybe people will be fooled into thinking it's different than a toolkit. Oh, I'm sorry. There's a question in the chat. When they respond to applicants, if they replied, and I think the question is when asking when are they going to let people know if they're eligible, like if they can apply for the subsidy. So by the end of September, so the first step is, sorry, I'm going back. The first step is actually filling out that very short survey, very short form. And then by the end of September, we, Public Health and Best Starts for Kids, will get back to folks and let them know that that they were selected to complete the full application. So by the end of September, which is why it's super important for folks to fill out that first, I'm actually gonna do this real quick. I'm gonna put the link in the chat. So for folks can do it now even if they want. I don't, that's not it. I want to ask if I want to verify my own site. Yes, I do. So I'm going to put the link in the chat when it actually lets me do it. So if folks want to do it now, I don't care. You can multitask. All right. And then the answer to your question, and thank you so much for asking, is by the end of September, folks who make it through the first round will be asked to fill out a larger application. And again, it just depends on how many applications we get, whether or not we will be able to support, everybody or most people who apply. All right, thank you for asking that. Any other questions? Sorry, that is usually why I give it a minute before I move on so folks have time to type or unmute. All right, and then the link that I put in the chat will get you to that short 5-minute survey. And then I'm going to put this one in too for all of you folks out there who are who work for community-based organizations. I know a lot of you on the call. That's the link to our toolkit to help supporting your clients and patients and friends and family. I have family members I'm going to send this to as soon as I can. All right, so any other questions before we move on? All right, so like I mentioned, we had folks come and talk about the school guidance and recommendations, and now we do have an updated toolkit really to help. Oh, sorry. Does the BSK subsidy is it also available for families that cares for children of family members? Unfortunately, I do not know the answer to that. Is there anybody on the call who is with BSK who might know the answer to that? That's a great question. A lot of family members are caring for. My guess is if folks are legal guardians, absolutely. But anyone on the call from BSK who knows the answer to this? Okay, so I will ask that question. Hold on, I'm going to get out of this again so I can write that down. Oops, y'all don't need to see that. All right, I just want to take notes and make sure that I get back to you about that, or I put it in the response. Awesome, thank you for asking. Oh, so you said it needs to be a licensed child care program. Got it. I guess I was thinking that, so I guess the question, thank you. I think you understood, Sawyer, the question differently than I was understanding. The way that you're understanding the question is, can folks who are taking care of children of other family members receive the subsidy? And I was misunderstanding that as they were like, or I was understanding that they were maybe not legal guardians, but the child was living with them. if they're providing the child care for a child, but the child is not living with them, that is exactly the answer. Thank you, Sawyer. That no, that would not, they would not be able to receive that because it needs to be a licensed child care program unless they do run a licensed child care program. So if you could let me know if that answers the question, that would be great. Or if you were asking if like someone is taking care of a child full time in their home, even though they're not legal guardians, like grandma is taking care of grandchild while parents are somewhere else. If that's the question, I can look it up and find out. Yeah, okay, so while the parents are working. So then the answer would be no, unless they were a licensed child care program. Thank you. I was misunderstanding that question. So no, they wouldn't be unless unless that person taking care of them did run a licensed child care program. So as I mentioned, we have a new toolkit. And this is really for both parents and providers, but to help, like providers can help support and schools can help support families in going back to school. And so we have the toolkit in, we have a PowerPoint, we have different documents and like flyers that folks can use, and schools could use them to send out in newsletters or on social media, and the same thing for nonprofits and community organizations who work with families who have school-age children. The toolkit currently for children who are 6 months to 5 years is currently in English, Chinese Simplified, Chinese Traditional, Somali, Spanish, and Vietnamese. And currently for children 5 to 11 is in English and Spanish. And I have a feeling again that that will be expanding. And then we also have some blogs that are helpful as well for schools and for parents as well. This is actually the PowerPoint that goes with the toolkit, is what to expect this school year. And this is an effort to lower the risk of COVID-19 among children and young people. So again, the state guidance is to get vaccinated and boosted, to stay up to date on boosters, to stay home if somebody is sick, even if they're like, oh, I just think I have a cold. They want to stay home if they're sick, and they want to make sure to get tested. They can do a home test. It's really important to know that if somebody does have COVID, they're actually contagious 2 days before they ever have symptoms, and about 40% of people who get COVID never have symptoms. So if someone's been exposed to someone else, again, they want to get tested. If someone's sick, they want to test right away. If someone was exposed, they'd want to get tested, either do a home test or go and get tested at, we often say 5 days. I would say like 3 days, and then again at 5 days. If it says negative or that they don't have COVID, they still might have COVID. If it says that they do have COVID, or if it's positive, they definitely have it. So also improve ventilation whenever possible. And again, we have folks who can help support schools in improving ventilation. and wearing a mask and taking precautions during like outdoor breaks and other breaks when our community levels are high. I know you heard from Matthias that our rates are going down. And again, so many folks are doing home tests that we don't have accurate numbers, unfortunately, of our rates right now. The best way to stay healthy and avoid school outbreaks for students, families, staff is to both get vaccinated, but really to stay up to date on your vaccines, meaning to get boosted when you're eligible. And this new booster that includes Omicron and BA4 and BA5 is very exciting because people who get BA5 can get it again. And we've seen people get it again even in less than 2 weeks because it can bypass immunity. So the booster is really exciting that it is out. And there isn't a prioritization for it, and like anybody who's eligible can get it. And the COVID-19 vaccine is available for children who are 6 months and older, and boosters are available for children 5 years and older. And then this new booster is 12 years and older. So the Omicron booster. The thing to say about the Omicron booster, if Matthias didn't mention it, is it is also it's your traditional booster, and then also includes Omicron, BA4, and BA5. Sorry, I'm trying to get my mouse in the right spot. It's not working. Let's try that. All right, and then when to stay home. Students and staff need to stay home if they have COVID-19 symptoms or if they test positive. Oftentimes, if they go to school with symptoms, they'll get sent home or sent where they live. So it's really hard for parents and guardians and caregivers. And at the same time, we want to make sure not to have outbreaks at schools and make the situations worse. So people want to stay home when they're having symptoms. Symptoms are pretty much everything. Sore throat, headaches, diarrhea, and this is new thing. Like if someone, you know, you have allergies and you've had allergies for the last 3 months, you don't have to stay home today because you have the allergies again. But if you're having new symptoms, young people, we see, we'll often see like digestive stuff like diarrhea and throwing up, but adults can have that as well. And then loss of taste or smell. So those would be some of the symptoms: chills, fatigue, or being tired. And then if they test positive, they need to stay home. And then they also need to stay home if someone in their household tests positive or has been diagnosed with COVID-19. And they've been diagnosed with COVID-19. They're not staying home, but they should wear a high quality mask for 10 days and get tested on day 5. So if you've been exposed to COVID, someone in your house has it, you don't need to stay home unless you're also having symptoms, but we highly recommend wearing a mask to protect the folks, the other folks in the classroom. And then again, if during that 10 days, they do get symptoms or they test positive, they would need to stay home. So if someone tests positive, parents and children who test positive must stay home and isolate for 5 days. They can return to work. I know that there are some workplaces that do require a negative test before they can go back. I also know that I said that we don't recommend doing another test once they have a positive test, but some workplaces do require a negative test before they can go back. But they can return to workplaces that don't require that, or school, if their symptoms are improving and they've had no fever for 24 hours without the help of medication. But if they get new symptoms, or if they're still having a fever without ibuprofen or Tylenol or something like that, then they do need to continue to isolate. If their symptoms are improving and they don't have a fever without medication, they they can go back to school and work, but they need to wear a mask for the next 6 to 10 days. And then again, in those 6 to 10 days, if they get new symptoms or the symptoms get worse again, they need to start isolating again. And then one thing that's optional is people who choose to test on day 5 and get a positive result should isolate for another 5 days for a total of 10. And then again, that's making sure that we're not continuing to, or not causing an outbreak in our schools. So masking is not required at schools, and only school districts can decide when, like if there is an outbreak, a school district may decide that they're going to mandate masking for 2 weeks. Again, there's always exceptions to masking based on some disabilities or some reasons why folks can't use masks. But again, like a teacher can't decide that their classroom will always wear a mask. A guest speaker can't. I am a guest speaker in schools a lot. I've asked that question. At the same time, it's just a good reminder that masks really do help protect us, but what they're better at is protecting the folks around us. So it's always a good recommendation to have a mask with you, because in general, a lot of places do require masks. A lot of businesses require masks. So it's always a good idea to have them on you, but the same for children and childcare, schools and childcare. It's a really good idea to have masks with them in case they don't feel safe or decide to wear one. And then again, to find out about like routine childhood vaccinations and for your low-cost vaccination clinics, the website is kingcounty.gov/find-a-clinic, and the phone number is 1-800-756-5437. And I'm going to look at you all again for a moment, and could folks do me a favor and give me a thumbs up if you would be interested in me having somebody come here and do a presentation on routine vaccinations, so not just COVID, but childhood vaccinations in general. And since so many children are behind in their vaccinations due to COVID. I only see one thumbs up, so I'll give it another minute. All right, I see 2, 3. All right, it looks like most folks are not interested, but again, I can put my email in the chat and connect you. We might actually have a recording of one that was just done recently. We did a series on vaccines, and it included routine immunizations. And then Lena and Nazik, I can definitely introduce you to the person who works with us who does routine vaccinations. My dog is telling me they have to go to the bathroom. A poor thing, they're just gonna have to wait. All right, and I put my email address in the chat. I'm gonna give it one more second. Anyone else interested in learning about routine vaccinations for children? Okay. Links to the recording would be great. Okay, I have to, I did 2 of them, so I should know if they were recorded. I believe they were, so I will, and if that's true, I'll get them and send them out. That's a great compromise. All right, and then just a reminder, special considerations for childcare is that young children may have difficulty wearing a well-fitting mask consistently and correctly. I also want to remind folks, you know, a lot of the strikes that were happening recently for school districts were around special ed considerations. And so again, a reminder that it's not just young children, but also kids who have sensory issues or kids who have cognitive or intellectual disabilities or are not able to safely take one off or put one on, you know, are not able to wear a mask. So it's really important for us to keep that in mind and know that, and also think about how to keep them safe. I know folks were probably really upset about never mind, I ain't gonna go there. I'm just really glad that folks are thinking about special ed classrooms and how to keep them safer. And then again, we're gonna send out these additional resources for folks. All right, what time is it? Man, I can just talk. All right, again, remember, please ask questions as we go. This can be as interactive as you want it to be. We can have a conversation. Love conversation. All right, so I wanted to remind people that we do have resources available for folks who need to isolate or quarantine during COVID. So again, you get COVID, you live in a household with an elder, or you live in a 1-bedroom. My partner and I had to make like all these contingency plans before, you know, in the place that we lived for a million years, because we had a 1-bedroom. Like, how are we going to isolate? How are we going to quarantine? So for folks who do need support during isolation quarantine, there's a couple things that folks can do. So King County offers 4 locations that people can actually live at. And it's supported by our mobile isolation and quarantine care team. And I am putting this up here to show you that we have flyers about these locations in many different languages. And so folks can go and live somewhere while they're quarantining or while they're isolating, so that their household can stay safe, or maybe they don't have a household, they're unhoused, so they can stay safe and they can get better. And there's nurses available, there's behavioral health folks available, food that is supposed to be culturally relevant and appropriate food, laundry, clothing, and then also super important to know that like it doesn't end when you leave. There's actually care coordination that happens, and when folks leave, they get some support and planning for services that they might need after they're feeling better, and then they are either no longer quarantining or isolating. And then they also can initiate treatment for drug addiction while they're at these programs. While they're at these locations, if they're interested in that as well, which is exciting. So the options include 2 adult family homes in King County with a caregiver on site, so someone to take care of you. And then we also have hotel rooms in North Seattle and in Renton. And the spaces are available based on need, and if they're available. They're free, no ID is required, meaning someone does not have to be a US citizen. They don't have to have ID. And then service and emotional support animals are welcome, but other animals are not able to come. And then families with children and couples are welcome. And then services, again, are tailored to support people experiencing homelessness or unstable housing conditions, are open to anyone who can't safely isolate or quarantine at home, or if they don't have a home. So again, the phone number to call for this is 206-477-3977. And I will also send out information about, or you'll have the live links for flyers to share with your family members, clients, patients, friends as well. And then I think I may skip this because we just talked about it. Yeah, we just talked about it. But it's really important to know that at the centers, we do have mental health support. We have, meals. We have safe and clean linens, security, we have transportation and cable, and so all of that stuff is available at these locations. This is just a reminder, I already showed you this, but that please go to our website and print this out in all these languages for folks who who may need them in these languages. I think a lot of folks don't know that these exist, and we know that especially folks who are immigrant and refugee communities, often in BIPOC communities, are living in multi-generational households, and we want to make sure that we can take care of our elders and our family members. And then there's another program through the state called Care Connect, and Care Connect is specifically more focused on delivering food and supporting folks with other necessities when they've been exposed to COVID or they have COVID. So, and when I say like other necessities, they can help supply food, they can help people connect to services that will help them with medication delivery, getting unemployment, getting housing. And again, that will continue after they're feeling better as well. And oh, I'm sorry. And then there should be a place where it says, that also Care Connect can help, again, send food, send care kits, but also, again, super important for so many folks, support around money assistance and paying bills, and coordinating for care, and helping with rent and mortgage and utilities. So great. I wish we did this forever and ever, and not just during pandemics, that we're finally feeding people and helping support people with bills and mortgage and utilities. So just a reminder, we still have these programs available. And again, I will send out this email with the live links. And again, when the isolation and quarantine ends, the care still continues. So the care coordinator will continue to connect people to longer term care, and the services are regional based, so it depends on which region people live in, what support is available, but the care coordinator can let you know what care is available in your region and continue to support or connect you to those services after you're feeling better. So the phone number for that is 1-800-525-0127. You would press pound, and language assistance is absolutely available. So you just have to let folks know what language you need, and they will connect with a language interpreter. And that phone number is available 6 a.m. to 10 p.m. on Mondays and 6 a.m. to 6 p.m. Tuesdays through Sunday, including holidays. All right, an update on free home tests. I'm going to pause. I'm going to take a sip of my water. Any questions? All right. Before I do the update, I want to say you can still get free tests. So the federal government has now reduced the number of tests that folks can get due to lack of funding for the program. So now through the federal government, people can get free tests, 2 free tests, 2 times a month, and up to 2 orders per household every month. So that's through the federal government. Through Washington State, people can still order, can still order 5 test kits which have 2 tests in them. So what that means is here in Washington State, people can still get 10 tests per month per person in Washington. And again, I have all the links in this website to get them. They look similar, but they're different. So again, one would be federal and one would be state. And then other ways to get free tests is, again, what I just mentioned, the state tests, the Fed tests, health insurance most health insurance will pay you back for tests, or actually pay for them at the pharmacy. My strong recommendation is to check with your health insurance and find out which they do. Unfortunately, a lot of pharmacies just don't know. They're so overwhelmed that they just don't know the answers to these questions. So I don't want someone going and getting tests thinking they're going to be reimbursed, and they were actually supposed to pay for them there with their insurance card. So good idea to really check with your insurance company to find out how you get these free home tests each month. And then King County, we are giving, we have tests. We have our PCR test, or the test that you go and you get tested from someone else. And I have a link to the site there. And then our clinics have tests, and we also distribute them to local organizations. For instance, one of the statewide organizations is having a conference this week, and we were able to get them 400 tests for their conference. And then if you need help finding a site, a testing site, you can also call 1-800-525-0127 and press the pound key and state the language you need. And if you need Spanish, you would press 7. All right. We got 3 minutes. Monkeypox update is there's not a lot to update. Current cases are 413 in King County. Again, that's much lower than, and most of the cases in Washington are King County. Usually there's about 100 or so more in, like, outside of King County. But compared to places like Texas and California and New York, that's actually a pretty low number for metropolitan big city, Seattle, big city, metropolitan area. And then across the US, as of yesterday, 22,630 cases. Tammy, did you have a question? Oh, no.
No, I don't.
Okay. And then we've had 12 hospitalizations due to monkeypox here in King County of the 413. We do know one of them was a 4-month-old, and they were doing better. And I really hate these charts a lot. I wish it just was like numbers, but here's a breakdown in terms of like age. What you can see is most people who get currently, so again, anybody can get monkeypox. It's based on the behaviors that they're doing, and they're doing them with somebody who has monkeypox. So most people who have it currently are between the ages of 18 and 49. Most folks who have it in King County, overwhelming majority, so 96.6% are cisgender men. And cisgender man means a man that was assigned male at birth and also identifies as male currently. And you can see the breakdown by race and ethnicity. I want to apologize. I didn't write this slide, but so the language used in the slide is sorry, I had COVID 3 months ago. I still can't get word. Census is it's the language used in the census. So that's why, yeah. So I do want to apologize. I know where I grew up, a lot of the language on here would be offensive. But you can see the highest rate currently in King County of folks who have it are white men. We can extrapolate that by this slide that says 96% are men, and here 42% are white, and then 25% are Latinx. So super important, again, for, I know there's a really big push right now to get, by King County, to get information into Latinx communities, and then you can see 8.7% in Black communities. So really big push to make sure to do education in communities who are most at risk. We went through this last week, so I don't think we need to go through all this again, but I did want to put it in here again to send them out. The who can get vaccinated now, prioritization has changed. So anyone who's had close, intimate, meaning physical rubbing, contact, sex, or sharing beds and clothes with somebody who's tested for monkeypox is eligible to get vaccinated. Somebody who is gay or bisexual, or someone who is trans, and you saw the numbers, 96% are going to be cisgender men, and they've had at least one of the following: multiple or anonymous sex partners in the last 3 months, syphilis or gonorrhea, they've used meth in the last 3 months, attended the bathhouse or public sex venue, they're experiencing houselessness, and a lot of that is because you can also get it from sheets and towels and sharing sheets and towels, if they've been incarcerated in the last 3 months, and then again, if they are gay and Black, Latinx, Native Hawaiian, and other Pacific Islanders, Asian, Indigenous, or other Indigenous folks, and Alaska Native folks. And then the thing that we have also added is also sex workers of any sexual orientation or any gender identity. That is one place that we have strayed from the feds. Super important that folks who are sex workers of any sexual orientation or gender identity get vaccinated. So we are at time. Again, I'm going to remind you that the Sexual Health Clinic at Harborview has vaccination clinics, and CMAR Community Health Center has very limited vaccination clinics for monkeypox. Again, just a reminder, this is monkeypox. And again, I'll send this out with all the information. And then at the end of this, I want to remind you that there are resources at the end of this slideshow as well. We don't usually get to them, but how to sign up for insurance, and I get free breast and cervical exams, colon exams, OrcaList cards, and also in-home vaccination. So I just want to make sure you all know that there are some great resources at the end of this presentation that we will send out. Any questions? I feel like that went fast. I really apologize to the interpreters if I talked too fast. Between COVID and monkeypox, there's a lot. Any last questions that folks have for me? All right. One of the things, I'm going to put my email in again. We would love to start also offering presentations outside of COVID and monkeypox. One example for nonprofits or for folks who are mandatory reporters is I have an amazing colleague who provides trainings around mandatory reporting so that folks don't over-report. studies tell us that only 3% of kids who have been part of CPS system have said it helped them at all. And often what happens is it can break up specifically BIPOC or Black, Indigenous, Latinx families, immigrant and refugee families. So that's just an example of one of the presentations. Can also talk about reproductive justice, can talk about health equity in general. That's not the term I wanted though. Health literacy. So if you are interested in other trainings, please feel free to email me and let us know, because we always want to make sure that we're meeting the needs of folks, and hopefully at some point we will be able to stop talking about COVID and monkeypox as much, at least. And then again, if your organization would like a presentation in another language or in English, or a training of trainers for your staff, please let us know, or please you can email me and we can set that up. Because again, the more capacity out there in community, and the more that you are all sharing information with your friends, your family, your clients, your patients, the better. So happy to support. All right, I don't see any questions. I want to make sure to thank the interpreters. Matthias is so good. He did that first. I was like, you just showed me up, because I always forget to. But the interpreters are really the stars of the show and are amazing, and so appreciate the work that you do. All right, everybody, please stay safe out there. And yes, the new vaccine is available, 12 and up, and is widely available, and we do not have eligibility requirements on it. The only thing is, it has to be 2 months from either having COVID or 2 months from your last booster. And I know that's different than what we originally said, and unfortunately, we were told different information once it was coming out. So again, I apologize, but that is what happened. All right. Well, thank you, everybody. Be safe, take good care. And again, please share all of those different toolkits with your communities, your friends, your families, your clients. We work really hard on making them accessible to folks. So we would love your help in getting them out. Travis, I love watching you work. I have to make myself not look. All right, bye everybody. Have a wonderful night. Oh, Gina, thank you. Thank you, Gina. Oh my God, I can't believe I didn't say thank you. Thank you. I so appreciate you.
Okay, bye everybody.
I don't know that my hair was just mentioned. Yeah. All right, bye everybody. Have a good night.